We start, though, with the latest on the coronavirus situation in South Korea. The country continues to set grim milestone after milestone, day after day, as daily COVID-19 infections are skyrocketing right now. Adding to concerns is the confirmation of the first cases of the Omicron variant in the country.
For more on this and other related updates, joining us in our studio is our reporter Choi Min-jung. Good morning, Min-jung.
Good morning.
So let's start with today's figures. Are we expecting another high today?
Well, we did see another record high number of infections from midnight to 9 p.m. yesterday. Given that South Korea reported more than 4,300 cases in that period, we are expecting to see cases hover around the 5,000 mark once again. This is also a jump of 460 cases over the same time from the day before. What's also troubling is the increasing fatality rate. If you compare the data from August and November, the risk of dying from COVID-19 nearly tripled from 0.36 to 0.93%. This comes despite 80% of the total population now being fully vaccinated against the virus.
Yeah, that's a concerning statistic, the death rate going up, but making matters even more concerning, potentially, until we know more about this new variant, is the Omicron strain is now confirmed to be here in South Korea.
That's right. Authorities confirmed 5 cases of the Omicron variant on Wednesday. A married couple in their 40s contracted the variant after visiting Nigeria in mid-November. Their friend was also infected with the variant, and the results of their son, who is suspected to be infected as well, will come out on Thursday. Health officials are on high alert as the couple was fully vaccinated with the Moderna vaccine back in October, making them exempt from self-quarantine after arriving in Korea. Meanwhile, their friend and son were in quarantine after making contact with the couple, as neither of them had been vaccinated. Officials say that the couple and their friend are experiencing no specific symptoms other than respiratory symptoms and muscle pain. Apart from the 3, 2 more people have been confirmed to have been infected with the Omicron variant. The variant was detected in 2 unvaccinated women in their 50s living in Gyeonggi-do province. They also traveled to Nigeria in mid-November and are now being treated at their homes. Besides the 5 who tested positive for the variant, there is a total of 4 more suspected cases waiting for results. But what's most concerning is that this may be the start of a potential 5th wave. Over the past month, some 5,000 people entered South Korea from Africa and Europe, where the mutation is spreading quickly. Experts say transmissions of the mutated strain may also have already begun to spread in the local community.
So the situation seems to be getting more serious by the day. So, Min-jung, how is the South Korean government dealing with this? How are they coping with to contain the situation? And I heard that there were new measures that were introduced.
That's right. All travelers arriving in Korea, regardless of their nationality and their vaccination status, will have to quarantine for 10 days. The new measure will be implemented on Friday and last for the next 2 weeks. Koreans and foreigners living in Korea must go through self-quarantine at home and get PCR tests 3 times, once before arrival, another after arrival, and finally once before being released from quarantine. Foreigners who are visiting short-term will be quarantined in temporary facilities provided by the government. And also starting Friday, the entry of non-Koreans departing from Nigeria will be banned. But Koreans and foreigners who are staying long-term will be permitted to enter the country and will be required to quarantine at temporary facilities for 10 days. And they also have to take 4 PCR tests. The same measures had already been put in place for 8 other countries, including South Africa. The government has already decided to suspend direct flights from Ethiopia for 2 weeks starting Saturday, but the country will be organizing separate flights for the safe return of South Korean nationals. And on top of that, those who have come into contact with a patient infected with the Omicron variant will be required to self-quarantine for 14 days, and there is no exception for the fully vaccinated people. Currently, fully inoculated people are not required to quarantine even after making close contact with a COVID-19 patient.
Let's hope the measures could be helpful. Now, Min-jung, thank you so much for your report. We'll talk to you again tomorrow.
Thank you.